Hi again, and welcome to another supplement for Chapter 4. Please refer to your textbook as there are about 15 excellent pages of references for V-codes. The use of V-codes can get a little overwhelming, so this will be a short and hopefully clear introduction on how to use V-codes to make them a little less scary. V-codes are supplementary classification of factors influencing health status and contact with health services. The code ranges for V-codes in ICD-9 is V01 to V91. When we get to the transition to ICD-10, those same V-codes will translate into Z as in zebra codes. Why are V and Z codes important to our data sets? Well, not all patient visits are due to a current illness or injury. So, these V codes and eventually Z codes will describe instances when a patient encounter is something other than for an illness, disease, or injury. Here are a few examples of reasons for visits other than for illness or injury. People can present to a physician's office or a facility for routine physicals, follow-up or aftercare, pregnancy-related diagnoses, contraception or contraceptive visits for birth control options including but not limited to IUDs, oral contraceptives, or permanent sterilizations like tubal ligation or vasectomies. These categories also cover screenings for possible other diseases, inoculations and vaccinations for routine immunizations for work or school or travel, and counseling appointments for any condition or advice. Okay, now we're going to briefly just breeze through all the classification categories. We'll start with V01 to V09. Those are potential health hazards related to a communicable disease with a need for isolation and or prophylactic measures. Examples of this could be exposure to TB, meningitis, or hepatitis. V10 to V19 is potential health hazards related to personal and or family history. Some examples would be if you needed a mammogram because your mom had breast cancer, or you wanted a lipid screening or a routine EKG because your dad had a heart attack at an early age. Both of those conditions could influence your health care. V20 to V29 is people encountering health services related to reproduction and development. That would be for well child care, pregnancy-related visits, encounters for sterilizations, or infertility testing. The V30 to V39 category is for infants related to the type of birth. These are coded on the infant's hospital newborn record and reflect the outcome of the delivery. V40 to V49 are persons with a condition influencing their health status. These categories are intended for use when these conditions are recorded as a diagnosis or problem. Patients that have had a joint replacement, an organ replaced like a kidney transplant, pacemakers, or coronary artery bypass grafts or amputations. Okay, V50 to V59 section is for persons encountering health services for specific procedures and aftercare. This could be orthopedic aftercare following a fracture, therapy appointments, post-operative appointments, or wound care. Please note that category codes V51 to V59 are intended for use to indicate a reason for care in patients who may already have been treated for a disease or injury, but that illness is no longer present. The V60 to V69 category mostly covers counseling care for parent-child problems, academic problems, bereavement, legal, lifestyle issues, and convalescent and palliative care, including hospice care.